Kamala wants to extend, and this is another one of those big issues, access to affordable pharmaceuticals. These aren't nice to have things. This is not a new pair of tennis shoes. This is insulin that you need to save your life. And so when we capped it at $35 for seniors, she wants to take it for everyone. We did it in Minnesota. The reason we did it for everyone in Minnesota was there was a young man named Alex Smith. He turned 26 and got off his parents' insurance. He started rationing his insulin. He died. His mom, Nicole, came to the state capitol and said, never again will I have a mother lose her child. So we have $35 insulin for everybody. Not only is that the right thing to do, but this is the price gouging issue. They were charging for that little vial of insulin that we now cap at $35. They were charging $800 for it. It cost $5 to make it. They're still making $30 for each one. They will do just fine. So look, for all of us in here too, and the young folks in here, I know this one's not going to register much with you, but trust me, when you turn 60 and get in there, there's a couple things you really start paying attention to, Medicare being one of them. That's how we live with dignity when we get older. Kamala proposed having Medicare pay for in-home care so our seniors and our parents can live in their homes longer. Smart. Smart. Now listen, everybody, and they say, well, what are their concrete plans? You're not going to hear Donald Trump talking about this stuff because he doesn't believe in Medicare, doesn't believe in Social Security, doesn't care. But when she said, let's expand Medicare to pay for glasses and hearing aids, what a novel idea. What a novel idea. Now, Trump's plan, they had a bunch of experts look at it. Trump's plan will bankrupt Social Security in 6 years. 6 years. Now, I want to just talk about this on Social Security. When you're a billionaire and you're sitting down at Mar-a-Lago, and remember the reason he's a billionaire because his dad gave him $400 million. Any one of you would be multiple billionaires richer than him if you had it started out. But look, he doesn't give a damn if the Social Security check gets deposited or not. You know who does care? My nearly 90-year-old mom, because she pays for food and heat with that money. And you know what? She paid into it. She paid into it. Now, Donald Trump wanted to tell us, and J.D. Vance tried to explain to me after Trump's concept of a plan. He tried to explain the plan, and I said, you should go back to the concept, because when you explain it, it's even worse. Because what he explained is getting rid of the Affordable Care Act. And for all of you who've forgotten, and for folks in here, what Obamacare did was make sure insurance companies could not determine whether they covered you or not because you had a pre-existing condition. Yeah, we're not going back to that. These folks get it. Here's the old, even Donald Trump could figure out this business model. Insurance companies want to only insure healthy people, and they want to make it difficult for you to make a claim and collect the money, because that way they get to keep the money. What ACA said is, because you've had asthma when you were younger, or because you're a woman, or because you hurt your knee, you're not going to be excluded from this, and you're going to get health care, because guess what? Health care should be a basic human right to be able to take care of people.